Mama Project is a child survival program. Our focus is on communities affected by chronic malnutrition. Chronic malnutrition is the underlying cause of most of the deaths in our world in children before their 5th birthday. Pneumonia is the most common cause of death in these children. The child's weakened immune system cannot adequately fight off infection, and the child dies when a child without micronutrient deficiencies could have survived. Malnutrition, of course, is not the only problem faced by these communities with high rates of pneumonia mortality in children. Very often the families are living in poverty without access to medical care. Also, there are environmental factors that make children more vulnerable to respiratory illness and death. Pollution by chemicals and smoke associated with agricultural practices is harmful, especially to children. And we should also mention the smoke that the children encounter in their homes from cooking fires without adequate ventilation in chimneys. So, as we discuss a specific technology that can help children having asthma attacks, let us never lose sight of the big picture. When evaluating a sick child, you first ask for general signs of danger. Is the child not drinking or breastfeeding? Does the child vomit everything? Has the child had convulsions? Then you look to see if the child is lethargic, unconscious, or convulsing now. If the answer to any of those questions is yes, that child is in danger. No matter what their illness is, that child needs priority attention. Next, ask about coughing or difficulty breathing. Then count the breaths in 1 minute when the child is calm. If the child is 2 to 12 months old, fast breathing is greater than 50 breaths per minute. If the child is 12 to 60 months, 1 to 5 years, fast breathing is 40 breaths per minute or more. Now, if you find that the child has cough or rapid breathing, you will proceed to assess and classify the signs and begin treatment according to your findings. When looking for signs of pneumonia, either severe or moderate risk, we look for general danger as discussed, but also observe if the child appears to have chest indrawing or labored breathing. When you see the child fighting to breathe and you see an indentation above their chest wall or below their chest, below their ribs, that child is said to have chest indrawing. That shows that they're really moving working to move air. If they have stridor, in other words, you hear noise like that when they're breathing in the upper airways, if you hear wheezing or other noises in the chest, those are danger signs. They may be having an asthma attack. So, give a trial of inhaled bronchodilator for up to 3 treatments every 15 to 20 minutes. If the symptoms persist, then classify and treat the respiratory illness with appropriate medications, including antibiotics if necessary, and referral to the appropriate level of care. Very good summary instructions for assessing, classifying, and treating children with respiratory illness are available in our Child Survival Program Manual. They're based on the World Health Organization Integrated Management of Childhood Illness Manual. First, you get your nebulizer and you plug it into electricity. If there is electricity. If you don't have electricity and you don't have a handheld multiple dose inhaler, then there is an alternative technology that should be able to work in just about every country, every community in the world, and that is to use a bicycle pump to nebulize. In our child survival training, we have one page that talks about the steps to nebulize with a manual nebulizer. So you can refer to that later, but right now we'll demonstrate the technology. My assistant, Dr. Herman Sagastume, will be the manual, and I will be the electric. Now what we're going to do is open 2 sets of tubing and hook them up. There are 2 versions of the bicycle pump. One is the one that you use with your hand, and the other you use with your feet. Now first, Dr. Herman is going to show how effective it is to nebulize with albuterol 3 cc's with the bicycle pump. Okay, now we're going to hook up the foot pump in the same manner. And we're going to show you how it works with the foot pump. And we're going to have a contest to see which one goes faster. We are going to nebulize till the liquid is all gone. And we'll just show you that the foot pump works quite fine, as does the hand pump. You do tend to get more tired using the hand pump. The child getting the treatment will have an improvement in their asthma sometimes within 2 minutes. Whereas if they took the medication by mouth, the onset of action will be slower, although if there is no bicycle pump, they can take the albuterol or salbutamol, same thing, by mouth, according to the dosing directions. It's just about a tie. For a child or a person who is in distress so much that they don't want to use the mouthpiece, you can nebulize with the mask. When you have a child or an adult with an asthma attack, in the case that you don't have the vials to use in the nebulizer, the solution of 20 mils is the usual presentation to use in the nebulizer, or a handheld inhaler for an asthma attack. You can use tablets. You can either take them orally or you can crush them and nebulize them, and we will show you how to do that. The instructions are in our child survival materials. We're taking a 4 milligram pill and crushing it. This is to speed up the dissolution. So you can see that this is being crushed into a powder. To the powdered albuterol, we add 3 milliliters of pure water, or 3 cc's. And you can use the water that we have filtered and chlorinated, or you can use boiled water, or you can use pure water that you purchased. You then stir it to dissolve the albuterol tablet. When you're satisfied that it's all dissolved, and it dissolves readily in water, you then put it into your nebulizer. You can use the pills. However, the onset of action is quicker if you use the medication by nebulization. Within 2 to 20 minutes, the child will start to feel better. Working the foot pump can be tiring, especially if you give more than one treatment. So family members should take turns and possibly trade off a little bit with the hand pump and the foot pump. When we did our demonstration, we opened up a clean setup of nebulizing tube, and that's very important, but it's also luxurious. Not every family or even every community is going to be able to keep supplies of the fresh, new nebulizing tube to use for every treatment. So it's very important that we sterilize in between treatments. So what we're going to do is take the apparatus apart, and we're going to make a sterilizing solution, and we're going to sterilize our equipment and the tubing and show you how that should be done between every use. So we just take a pot, any pot or pan that's clean in the house, and we want to put 9 ounces of water. This is a measurement of an ounce. So 9 ounces of water, or a cup plus a little. 1, 2, 9. Now we're using pure water. However, if you don't have access to bottled pure water, you can use the water cleaning and chlorinating system that we've also demonstrated in a YouTube video. Now we'll take 1 ounce of chloride. Every community has some brand of chlorine bleach. It does not have to be brand name, but chlorine bleach, household bleach, that's a sterilizing amount. And you soak your apparatus, take it apart and soak it in the chlorine bleach, the sterilizing bleach, and you want it to get into all pieces of the setup. You want it to go through the tubing, and then we just get a syringe and push the solution through. Okay. Now we're going to let the apparatus air dry. And keep it clean and covered for the next time that we want to use it. We can also demonstrate that you can blow out the inside of the tube using the bicycle pump. If you used it and set it aside without sterilizing it and blow drying it, you would be likely to have mold grow in that, and you'd rather not do that. Please contact us at info@mamaproject.org if you're interested in knowing more about our child survival program.